All right, friends, we're live, and I'm gonna just check the YouTube, make sure we're on. But we're gonna talk about seizures. So beyond the titer, seizures are one of the most common and most frustrating symptoms I see. All right. So seizures are one of the most common forms of disseminated valley fever that I see in dogs, and it's frustrating. So let's get into it. So I actually, before we get into it, I actually just did a consultation today on a dog with valley fever, and she's had valley fever for a while, and she developed neurological problems. And it's very frustrating because the neurologist just told her to discontinue all the supplements um, and do the anti-seizure medication and the fluconazole. And this is one of the dogs that's in my book, Conquering Valley Fever. So, Conquering Valley Fever. Um, so we have to get her back on track now. And the neurological problem is pretty severe, and they have no cure for her. But I want you to realize, or I want you to know that you have a lot more options than the conventional vets even know about. So the conventional vets will typically take your dog off of all the supplements and herbs, and this is what happened to this dog. Um, and they told her that they don't want to use anything that didn't have research on it. And everything that we're going to talk about today has research on it. So vets just don't bother to look. If they would pull up PubMed or Google Scholar and type in an herb name, they would see pages of research studies on these herbs. So nothing that we're going to talk about um, does not have research in relation to seizures and dogs and even fungal infections. So uh, seizures can be difficult. Um, they can be the grand mal, where you have the full blown seizure where they're just throwing themselves on the floor, jerking around, peeing, pooping, salivating, just a mess. So you can have the grand mal seizures, but you can also have the petit mal seizures where it's just kind of a twitch. You can have muscle twitching. You can have like chewing gum seizures where they look like they're chewing gum, or fly catching where they look like they are trying to snap a fly with their mouth. So there are all kinds of different situations that can be a seizure, and we want to recognize those right away. The other things that we see with valley fever in dogs with neurological problems is we'll see vestibular disease where they lose balance, or even behavioral changes. So that needs to be addressed if you notice behavioral changes, like um, kind of like dementia. They lose potty training. They just seem out of it. And in the severe cases, it's called stupor, where there's like nothing there. And that's what happened to Katie, my dog. She's in my book, Conquering Valley Fever. Um, when valley fever went to her brain, she developed encephalitis, and that caused stupor, which she was just totally out of it. Uh, let's do a quick refresher on valley fever. So, valley fever is a fungal infection, lives in the soil. The spores get airborne, they're inhaled and land in the lungs in any mammal, dogs, cats, people. The spores turn to spirals in the lungs, which produce endospores, and they get released in the lungs and produce more spirals. And you have the life cycle within the lungs. And if it's not contained there by the immune system or by medication or both, then it can spread throughout the body. Early symptoms are flu-like symptoms: lethargy, cough, weight loss, pain, stiffness, very vague and easy to miss. Seizures can actually be a first symptom because a lot of times these early vague flu-like symptoms are missed and they resolve, um, and and then the valley fever is still there and it goes other places. So sometimes a seizure is the very first symptom that someone notices, um, and then the dog gets diagnosed with valley fever. So anytime a dog develops seizures, we do need to test for valley fever along with all the other tests that we do for dogs with seizures. And that's most important for dogs in the Western United States, but it's also important for dogs who have visited or traveled through the Western United States from California, Arizona, Mexico, Nevada, um, Utah, Oregon, Washington, and and even further. So if your dog and you have visited the Western United States and developed seizures later on, valley fever needs to be tested for. It gets missed a lot, and it's really important because the seizures will go away once the valley fever is gone. So we need to take care of the valley fever. All right. So valley fever, when it gets into the brain or the central nervous system, one of the most common things that happens is inflammation in the brain or meningoencephalitis. So that's basically a long word for inflammation in the brain and the covering of the brain. It's really hard to confirm. MRIs can be normal, and that's actually what happened in the consult that I just did, because they were trying to tell her that the seizures that she developed were 100% not related to valley fever, and the MRI showed meningoencephalitis signs. So it very well could be. So it's really hard even to diagnose on an MRI. Also hard to diagnose on the cerebral spinal fluid taps that they do when the dog has an MRI. The titer can be negative, which makes it really frustrating. So you don't get confirmation that you've got valley fever. So it's tough. It's tough to diagnose, but if you have a dog with seizures and positive for valley fever and we know it, that's what I'm gonna talk about today. I'm gonna talk about your options. Um, Other things that, can cause seizures along with valley fever or instead of valley fever are things like, um, hypothyroidism, the tick-borne diseases, Addison's disease. So it's really important to do a complete blood test when your dog first gets seizures. So we need to make sure that there aren't complicating factors. The other thing that with seizures that you need to know is there are certain drugs that can reduce, um, the seizure threshold, meaning a seizure is more likely to happen because, the threshold is lower, so it's easier for them to tip over into a seizure. Drugs like heartworm preventatives, like, Heartgard or milbemycin, carprofen or Rimadyl, those drugs can lower the seizure threshold and actually cause seizures in a dog that's prone to seizures, so be aware of that. I also had a case where actually a couple cases where fluconazole was causing twitching. And fluconazole is used for valley fever, and it's the most effective antifungal for valley fever in the brain because it crosses the blood-brain barrier. But I've had a few cases where it caused neurological problems with twitching, which is kind of counterintuitive. But you do have options. If we can't use fluconazole, we can use other things. So um, we've got options, and that's why I'm talking to you. Okay, so the seizures will resolve when the valley fever resolves. So we still have to address the valley fever and the seizures. Um, an emergency when it comes to seizures is um, when a dog seizures and it doesn't stop for 5 minutes or more, or they have a seizure, whether it's just a short seizure or it's 5 minutes over and over and over, especially if it's more than 3 seizures in a day. That's an emergency. So when you have multiple seizures or seizures that last a long time, like more than 5 minutes, or don't stop, that's an emergency. Your dog needs to go to the ER. So I kind of alluded to the lab work. Yeah, that we need to do a complete profile when a dog um, starts seizuring. Yeah. So we do the CBC, which is the blood cells. We do a chemistry panel that looks at liver and kidney and proteins and electrolytes. We do a complete thyroid panel because, like I said before, thyroid problems can cause seizures. We do a urinalysis. We do the valley fever titers. We do tick-borne disease, like a heartworm 40X, which checks for heartworm disease, but it also checks for tick fever, Lyme's disease, and a plasma. Sometimes we'll do a resting cortisol, and that's a kind of a screening test for Addison's, which can induce seizures, and that can be done with urine, so that's a little easier, but it's just a screening test. The other thing that's really good to run is a food sensitivity test, and we'll talk about that in a little bit. All right, and then some more advanced testing would be like the MRI and the CSF tap, and a holistic advanced test would be a gut microbiome test. And I'm going to go over that a little bit more because there's some really interesting research out there right now. All right. So, well, let's get into it a little bit. So, we there's a gut brain connection. So, um, leaky gut or chronic GI problems, and actually, your dog can have leaky gut without chronic GI problems. That's possible. But there's a link between the gut microbiome and the brain microbiome. There's also a link between food sensitivities or food allergies and seizures, and that happens in people too. If some people and some dogs are allergic or sensitive to foods, and it will cause a seizure. So, uh, a food sensitivity test like the let's see, let me get a QR code for that. There's a pet food sensitivity test that you can run on your dog's saliva and check for food sensitivity so that you know if your dog is allergic to something and you can avoid it. The other thing with food is in people, they do the ketogenic diets, which are like the high protein, high fat diets. Dogs don't get into ketosis like people do. They just don't achieve ketosis. So that's not our goal. But our goal is a fresh food diet that's high in protein. Uh, so that's important. So the interesting thing about gut-brain connection, um, we used to think, actually, we still think that to have the microbiome in the gut balanced will help the brain because the microbiome in the gut makes neurotransmitters for the brain. So it it actually has to be healthy to make the proper and a proper amount of neurotransmitters for the brain. But they are actually just finding, or at least they're just reporting that there is a brain microbiome. So the brain actually has its own bacteria. They're finding bacteria in normal brain tissue. So they're thinking that the brain has its own microbiome, which makes it even more important to have a healthy microbiome because your skin has a microbiome, uh, the bladder and the kidneys have a microbiome, and the brain now has a microbiome. So all these things that we didn't know before are starting to make sense and kind of click because There have been studies. In fact, there was one just on Instagram this morning that I think Karen Becker posted about the gut microbiome. Uh, Dogs on probiotics with a healthy microbiome uh, had less seizures. So, so that's important and interesting stuff. So, conventional treatment. Um, Fluconazole is the drug of choice for valley fever when a dog has seizures or other central nervous system issues or neurological issues. It crosses the blood-brain barrier, and uh, it's actually probably the most cost-effective. But it's important to have your dog on fluconazole when they have seizures caused by valley fever. If your dog has a reaction to the fluconazole and cannot take it, the next best is voriconazole, which is more expensive, not commonly used, but that's the next step. Sometimes vets will use posaconazole, but the voriconazole is a better option. The fluconazole can't be used. Um, for general seizures, the anti-seizure medication, like if your dog has a seizure and they're trying to get it under control and you're at the ER, they may use something like Valium IV or phenobarbital IV. So they're going to get the seizures under control. And sometimes Valium or diazepam is sent home with pet parents to use in the event of a seizure, because that can be given in multiple ways, for example, rectally. Um, but the medications for seizures that are commonly used for dogs with valley fever are phenobarbital, uh, Keppra, potassium bromide, and zonisamide. And a lot of times, dogs are on 2 or 3 of these. Like, they're on several anti-seizure medications. Seizures can be really hard to get under control with only conventional medications. It's frustrating. And um, conventional medicine doesn't have much else. I mean, they can play around with the antifungals, they can play around with multiple anti-seizure medications. Sometimes they'll throw in prednisone as an anti-inflammatory for the brain, which is not a bad idea if they can't get the seizures under control. It helps with inflammation in the brain. Um, but that's all they have. And like I said, things that can worsen the seizures are something like carprofen or Rimadyl. So you need to look at all the other stuff your dog is on, like if they're on Rimadyl for arthritis or they're on HeartGuard for heartworm prevention. We need to modify that because those can induce seizures. So, so what are your options? There are a whole ton of options that we have for seizures and valley fever. And the cool thing is they're all researched. So there's these are science-based modalities. Um, so if your conventional vet is like, oh, there's no research, all they have to do is look it up on PubMed. There's tons of research. So the first thing I want to talk about as far as holistic kind of therapy for seizures and seizures related to valley fever is CBD. Get rid of that. All right. CBD is really interesting, and there's a lot of it out there, and a lot of stuff is not good. So you want to stay with your reputable brands. But CBD is something that we can give dogs to help with seizures. But the interesting thing is that all mammals have an endocannabinoid system already in their body. So they already have the receptors and the endocannabinoids are produced in the body already. So there's this network of naturally occurring endocannabinoids, and there are receptors in the brain and the nervous system. So by giving your dog CBD, it interacts with the receptors that your dog already has in the brain, and helps lower that threshold for seizures. Really interesting. Yeah, CBD does do some things like, um, it inhibits the cytochrome P450 enzymes in the liver, and sometimes we can get liver enzyme elevation with CBD, so we need to watch for that. And more importantly, we need to watch for that because, um, CBD, because it affects these enzymes in the liver, it will actually slow the metabolism of drugs like fluconazole and phenobarbital so that they're not metabolized so quickly, and they can build up in the bloodstream higher than expected. So when your dog is on CBD, you wanna talk to the neurologist if they know about it, and your vet, and potentially modify doses because a lot of times you're not gonna need as much fluconazole or as much phenobarbital when your dog is on CBD. So you have to really monitor blood levels, and keep up to date with your rechecks with your veterinarian and the neurologist. Yeah. So CBD is really potent, has some important caveats with the enzymes in the liver and slowing down the metabolism of drugs. So we do need to be careful with that. But CBD is very effective. In fact, I've had several dogs that have controlled their seizures just with CBD, which is pretty amazing. So there is a randomized placebo-controlled trial that was done at Colorado State University that showed that 89% of dogs that received CBD experienced a reduction in seizure frequency. 89%. That's pretty good. So, CBD is really important for dogs with seizures and with valley fever seizures. Yeah, a great product. Let me show you one of the products I like. I actually like only 2 products of CBD. There's not many I trust out there. This is one of them, the Heal CBD from CBD, for dogs. I like this one. I trust it. The other one I trust is, uh, Robert Silver, Dr. Robert Silver's CBD. I think it's called Doc Silver's CBD. I like that one too. Okay, let's go into some herbs. Oh my gosh. So there are researched herbs that have been used for hundreds and thousands of years for seizures before they called them seizures. So commonly in formulas for herbal formulas for seizures, you'll see skullcap, you'll see tianma, which is gastrodia, you'll see uncaria or gambir or guten, which is all the same thing. It's called hook vine branch. They use the branches of this vine and they have these sharp hooks on them. They're really interesting looking herb. You'll also see herbs like valerian, which is, I always think about Valium when I hear valerian, 'cause it works to calm seizures. Passion flower you'll see in some of these formulas. Turmeric or curcumin is anti-inflammatory, so you'll see that in some of the seizure formulas. And then blue vervain is another one. So those are all individual or herbal singles. Now, I use, and most herbalists, in fact, probably all herbalists will use formulas where a formula is put together and you'll have the anti-seizure herbs in there, but you'll have other herbs that do other things like um, take care of any deficiencies. So if there is, um, like a Western thing would be anemia, and that actually is common with valley fever related seizures. There are other herbs in the formula that do other things that and help the other herbs work. So there's herbal synergy within a formula. And when you combine herbs intelligently or use classical formulas that have been used for hundreds or thousands of years, and we know how they work, uh, the combination of herbs works like 10 times or 100 times better than the herbs individually. So combinations or formulas are generally used for seizures. I was looking back in um, my consults that I do for dogs with valley fever, and there were several herbal formulas that kind of popped up a lot that I use a lot. One of them is called damp heat in the mind, and that's when we've got the encephalitis or the meningoencephalitis, a lot of inflammation in the brain. Um, that's a combination of herbs, and interestingly enough, it has isadis and platycodone in there, and those are two of the herbs I have in my canine valley fever support tincture. So we'll talk about that too. A couple of the other herbs that I use commonly with dogs with valley fever seizures are detentong, which is a formula that clears seizures, and is used for dogs that generally are hot, tend to be excessive and hot. So this is not really something I would use if the dog is, really down and out. So the herbal formulas have to be prescribed for the right patient, otherwise they don't, or they can have reactions. So we have to pick the right herbal formula for the right patient. Um, so detentong is one that I use. And then another combination that I use, and I learned this one from Dr. Steve Marsden, is the Chaihu Jia Longu Mulitong and Longdong Shigantong. So it's two big herbal formulas used together that helps with immune modulation and stabilizes neurons, so they don't get overexcited and seizure, and inhibits glutamate release and all kinds of fun stuff. So there's research on all this. So they actually know what these formulas and what these herbs do in the body to stop seizures or prevent seizures. Cool stuff. Getting back to my canine valley fever support tincture, has a couple of the herbs that are used for seizures in it, like isadis and platycodone. It's an antifungal formula, but it also helps with other things, like fever and cough, um, and pain and inflammation, and it can be used along with the pharmaceuticals, like the anti-seizure pharmaceuticals and the antifungal pharmaceuticals. So it can augment those. In fact, all these formulas I'm talking about can augment the anti-seizure medication and the antifungal medication. So they can be used together. And that actually can help reduce the dose that your dog has to take of fluconazole, uh, or the anti-seizure medications, because those are the ones that cause the side effects. The pharmaceuticals cause, liver side effects, kidney side effects, gastrointestinal side effects with the antifungals. So if we can get away with the reduced dose by adding some herbal formulas in, that's going to help your dog, because we want your dog to be happy and clear valley fever and clear those seizures. So the more we can do to combine these, will help your dog in the long run and hopefully get rid of the seizures and the valley fever faster. Another supplement that I use is a standard process supplement called Neuroplex. It's a human supplement. And standard process is a company that makes glandulars. So a lot of their products are like dehydrated glandulars, uh, like brain, adrenal gland, um, liver, all kinds of glands, and then also some herbs in there and some nutraceuticals. So standard process Neuroplex is a really interesting formula. Um, and I actually had one dog, it was a lab, I think it was a black lab, that if they were on herbs and they were on the Neuroplex and they were on a special diet, like all these things. But if they ran out of the Neuroplex, the dog would seizure. So they knew that was a really important one. So that was interesting for me to know that the Neuroplex was actually helping that much that when they ran out, the dog would seizure. So another thing that I use for seizures is medicinal mushrooms, specifically lion's mane mushroom. So lion's mane mushroom works great for neurological or brain problems. Now, lots of research behind it. So it stimulates production of nerve growth factor and brain-derived neurotrophic factor. So all kinds of things researched for lion's mane mushroom. It helps with myelination, which is the covering around the nerves, and that's important for nerve transmission and supports the nerves, um, helps them survive under stress. So it's a real interesting supplement, and it modulates the immune system. So medicinal mushrooms in general will modulate the immune system. Um, so they can be used when there's immune suppression, like with valley fever, but they can also be used with an overstimulated immune system, like the autoimmune diseases. And valley fever can actually induce an autoimmune condition. And it commonly will induce something like autoimmune thrombocytopenia or autoimmune um, anemia, hemolytic anemia. So those can happen secondary to valley fever. And the mushrooms are wonderful to help prevent that and part of the treatment because they modulate the immune system and they're not going to hurt those conditions. But lion's mane is great. So think lion's mane when you've got brain problems, whether it's seizures, uh, cognitive problems, um, anxiety, anything brain related, you can use lion's mane mushroom with. I like um, Real Mushrooms is an excellent company for mushroom products, and they have a lion's mane mushroom powder, and you only need a little tiny bit of it for dogs because it's a human product. And actually, dogs take a higher dose than humans, believe it or not. So let me pop that up here, and I'll also show you uh, the next one, ashwagandha, that I use. But this is a supplement bundle that I put together for a lot of the things I'm talking about for seizures for dogs. So the the lion's mane is in there, and some of the other products I'm going to talk about next are in there. All right, so let's talk about ashwagandha. Ashwagandha is really interesting. So it's an Ayurvedic herb, and it's neuroprotective. So it helps protect the brain, protect the nerves. It helps regenerate nerves because when your dog has a seizure, it damages the brain. So every seizure that your dog has is actually frying the brain. It's damaging the brain. So we need something to get in there and regenerate things. Regenerate the nerves, regenerate the myelin. Uh, so ashwagandha is great for that. So it's neuroprotective. It actually helps reduce the plaques that they think are related to Alzheimer's. So that's kind of an off the wall kind of thing. But they look at ashwagandha for treatment with Alzheimer's, which is a brain disease. Um, but the other cool thing about ashwagandha is it actually increases thyroid hormone. And that's one of the really frustrating things about valley fever is most dogs that have valley fever long enough will start to get hypothyroid or low thyroid levels. And we always assume that that's a sick thyroid, meaning it's just um, it's suppressed on the blood work, but not really suppressed in the body. You don't really know that unless you do the full thyroid panel. But a lot of times that's what happens. The dog actually has enough thyroid because it's not being the thyroid stimulating hormone that's coming from the pituitary is not overactive. Um, but the dog doesn't have enough thyroid hormone circulating. And so veterinarians are always like, should we supplement with thyroid? Should we not supplement with thyroid? Sometimes we try it. Um, but what I do first is get them on the ashwagandha because that helps increase thyroid levels. So you're increasing the thyroid naturally and helping to prevent that issue down the line when your dog has chronic valley fever and you're trying to get that under control. Ashwagandha can help the brain and the thyroid. The other nice thing it does is it modulates cortisol, and that's another thing that goes wonky with valley fever in dogs because the antifungals that we use for dogs and people for that matter will suppress cortisol. And with chronic disease, our cortisol levels can increase because of the stress of chronic disease. So stress will increase the cortisol. Valley fever drugs or antifungal drugs can decrease the cortisol. So ashwagandha will modulate the cortisol. And if it gets too high, it brings it down to normal. If it gets too low, it brings it up to normal. So it's a really interesting, versatile herb. Um, and I actually have it in the bundle as a little treat. So not hard to give your dog, hopefully. Um, there are other things out there that do have research, um, things like taurine, um, B50, which is a B complex vitamin with choline. Both of those have shown to improve or reduce seizures in dogs with seizures. High dose glucosamine. There's research on using glucosamine at high doses to inhibit seizures. And I've got Nutraflex in the bundle, and I like that product for this because it has glucosamine, but it also has boswellia, magnesium, and vitamin C, which all help the nervous system. So that's a great product. Melatonin has anticonvulsant activity, really cool. And it also um, kind of resets the circadian rhythm because when dogs have seizures, their brain is like all over the place and they lose this normal, day and night kind of cycle. And it can be very confusing and it confuses the body. Um, and the metabolism and the physiology. So melatonin can actually reset that circadian rhythm. So that's an easy, cheap, nice thing to use for seizures. Nice thing about melatonin is if your dog is on prednisone, it actually helps reduce the side effects of prednisone. The panting like crazy, the drinking water like crazy, the peeing like crazy, all that. It can actually kind of tone some of that down, which is nice. The other thing that's real important for the brain is omega-3 fatty acids. Your brain is fat. There's a lot of fat in your brain. So the omega-3 fatty acids are really important. They're anti-inflammatory for the brain. And with valley fever seizures, the brain is inflamed. So we need to do everything we can safely to reduce that inflammation. Conventionally, all they have is prednisone as an anti-inflammatory, and that's not safe. So omega-3 fatty acids are inexpensive, easy to give, and very effective as an anti-inflammatory. Another thing is milk thistle. So you definitely want to protect the liver, and use milk thistle. Denamarin is commonly prescribed by conventional vets, and that has one of the chemical constituents of milk thistle in it, but not the whole herb. So if you add the whole herb milk thistle to denamarin, which just has one of the chemical constituents, it will supercharge the denamarin. So other things that I use for dogs with valley fever and seizures, acupuncture. So acupuncture actually um, helps um, modulate the neurotransmitters. So it decreases the neurotransmitters in the brain from getting too excited, like and causing a seizure. So it increases taurine, glycine, and GABA, which help the brain regulate and function, and it decreases the excitatory neurotransmitters. So it decreases the chance of a seizure. So acupuncture, if your dog will tolerate that, is awesome. So usually every 1 to 2 weeks until they're controlled, and then they go on a maintenance schedule, usually about once a month or so. If your dog is having a seizure or you know that a seizure is coming, and most pet parents can tell when their dog is going to seizure because they'll just kind of get funny, they'll get clingy, uh, they'll get wobbly, they'll look unstable, they'll look kind of like they're out of it. They just act funny when they're about to have a seizure, and that's a pre-ictal period. But what you can do when you recognize this, or even if your dog is having a seizure and you can get to this part of the body, you can stimulate the vagal nerve with ocular compression. So basically, um, when when the dog's eyes are closed, you want to put gentle pressure on the eyes when they're closed for about 10 seconds to 60 seconds. So you just wanna put some pressure on the eyeballs. Yeah, you don't have to do it hard, but that can help, stimulate the vagal nerve and stop that seizure, and you can do that every 5 minutes if you have to. So that's just a quickie tip on seizures. Alright, so we talked in the beginning about um, ketogenic diets, and dogs don't get into ketosis, but you definitely want to do a fresh food diet. It's kind of a non-negotiable because your kibble and canned foods generate a lot of inflammation in the body. And so we've got inflammation from the valley fever, we've got inflammation in the brain. We really need to reduce inflammation. And if we keep causing inflammation by feeding kibble and canned food, then we're we're fighting an uphill battle. Um, Whereas fresh food, because it does not generate advanced glycation end products or um, reactive oxygen species um, when it's being metabolized. Kibble and canned food, because it's heat processed, is metabolized by the body very quickly and produces free radicals like crazy. Whereas fresh food is digested or metabolized very slowly, and the body can keep up with that free radical production. Um, so we do fresh food and preferably a high protein because we want to kind of hedge toward the ketogenic foods. So you do low carbs. We don't want to do any starchy carbs. We want to use veggies for our carbs and meat and organ meat. And then I briefly talked about the allergy connection, so food allergies and seizures, especially in breeds like golden retrievers. Um, so you can do a food sensitivity test to check for food allergies and make sure you're not feeding something that can actually be worsening your dog's seizures. So it's good to know that. And then with um, with the microbiome in the gut, and the microbiome in the brain that we're now finding that there is bacteria, normal bacteria in the brain. They've found normal bacteria in the bladder, normal bacteria in the kidneys, and now normal bacteria in the brain. Pretty amazing stuff. So fermented foods or probiotics, something like Gussie's gut, and rotating probiotics can be helpful with the gut. So even if your dog does not have GI signs, it's important to uh, take care of their gut with the fresh food diet and things like probiotics and digestive enzymes. I don't know if I have, oh, I do. I have a microbiome test on here. Let me So this is a microbiome test. You can actually check your dog's poop. You send in a poop sample, and they'll tell you what bacteria are there, if they're bad bacteria, good bacteria, which ones they are, how many they are, if they have enough of the good ones, uh, and if there is an imbalance, they will tell you what supplements to use to get your dog back in balance. So that's a really um, quick and easy tests that can help a lot with your dog with seizures, and even with valley fever, because the 70 to 80% of the immune system is in the gut. So we still need to take care of the gut, whether your dog just has valley fever or has valley fever with seizures or is healthy. So you want to take care of the gut because that's where the immune system is, or a lot of the immune system. One question I get a lot is, well, what about rosemary? I can't use anything with rosemary because they say it causes seizures. And there are a lot of dog foods that use rosemary as a natural preservative instead of the chemical preservative. Yeah. So they've actually looked at this because they're like, "Ooh, is this a problem or not?" So basically, the rosemary caution is theoretical. It's precautionary or theoretical, because they found that high doses of the concentrated rosemary essential oil, if you take a lot of that, can lower the seizure threshold. But a normal amount of rosemary or rosemary in dog food that's used as a natural preservative does not lower the seizure threshold. So all the research was on really high doses of rosemary essential oil. So basically toxic amounts. So we're not going to worry about that. That's a theoretical concern with the normal amount of rosemary. All right, so putting it all together, when we have a dog with valley fever and seizures, it's basically a multi-pronged approach. Um, there's no single magic bullet. It's a commitment. And there are a lot of moving parts that we need to take care of. We need to take care of the gut. We need to take care of the valley fever fungus. We need to take care of the brain inflammation. We need to take care of the thyroid because that's going to get out of whack. We need to take care of the cortisol. Um, there are all kinds of moving parts with dogs with valley fever and especially seizures because that's just a really severe form of disseminated valley fever. So we want to think about fixing that diet. If your dog is on kibble or canned, we need to get them on a fresh food diet. Address the gut, probiotics, fermented food, digestive enzymes. Support the organs that are under stress. So the liver we support with milk thistle, the adrenal and the thyroid we support with ashwagandha. We treat the valley fever infection with antifungals or antifungal herbs like the ones in the canine valley fever support tincture. Do I have something for that? I do. Huh, I must not. Okay. Um, we need to calm the brain with either anti-seizure drugs, um, or anti-seizure herbs, or both. So the herbs can augment the drugs and reduce the dosage of the anti-seizure drugs that your dog needs, and also reduces the side effects, which is a win-win situation. We also need to think about reducing the total toxic load of your dog. We need to do an audit. Um, Vaccines, you probably wanna hold on, you wanna do titers. The rabies vaccine, rabies is a neurological disease. Anytime you have a neurological problem, the rabies vaccine can potentially worsen that. You wanna do blood titers of the for the vaccines to make sure your dog is protected if you're worried, um, and eliminate unnecessary vaccines. Okay, you also want to eliminate unnecessary pharmaceuticals or pharmaceuticals that especially may be causing a problem, such as HeartGard, Carprofen, or Rimadyl. You want to reduce environmental toxins like scented candles, uh, Febreze air fresheners, um, fragrance laundry detergents. Like there's all kinds of things that a lot of people normally have in their home that can actually be triggering um, seizures in your dog. So you want to take an audit of your home and kind of detox your home, and it's going to help you too. You want to give them filtered water. So tap water in most places is not healthy. So we want to give our dogs the same filtered water that we drink. And then don't forget that you want to do regular blood work, Titer rechecks, um, have rechecks done, and assessments done by your veterinarian or the neurologist, the veterinary neurologist of your dog to make sure things are going okay. Yeah. So the main point here is valley fever can cause brain disease, which can show up as seizures or vestibular disease or just twitches or behavioral issues. Um, and conventional treatment alone is often not enough. We need to think about all the things that we can do to augment the conventional therapy. And there are a lot of things. In fact, there are more things than I am even talking about today. So I actually have an article. Let me see if I have the link. I wrote an article on Substack about seizures. So that's my latest article, and there's another one coming out with more information and more herbs. So that's something that you may be interested in. So, um, what was I saying? Herbs. Okay, so augmenting the conventional medicine with the herbal medications or nutraceuticals or supplements and forgetting about diet. And with the herbal medicine, that's pretty specific, and we use targeted herbal therapy. It's not kind of a willy-nilly thing. So I would contact the veterinary herbalist. You can contact me. I do consultations. You can book a consultation with me, and I can help you figure out exactly what's going on and exactly what your dog needs, especially of the herbs, because there are a lot of different formulas out there, um, and not all of them are the right one for a dog with seizures and valley fever. So even the ones that I presented here as the ones I commonly use may not be the right one for your dog, depending on all the other things going on. Let me put this up. This is my consultation. So if you're interested in a telehealth consultation to go over what's happening with your dog, I do medical record review. I look at everything. I put together an action plan. We get on Zoom together, and you have 30 days of email support afterwards so that we can get everything dialed in. All right. Valley fever seizures. Dogs with seizures and valley fever. Frustrating, but you have options. You have a ton of options and more than I even presented here. So if you have questions, contact me. Um, and don't be afraid to start your dog on supplements like lion's mane or ashwagandha, extremely safe. Um, and I'll see you next week.